this week.
I went to the doctor. Doctor told me that, no, Goodman, nothing else you can do. You have to take this thing out. I was feeling scared to cut my toes.
The silent killer.
Diabetes is an awful disease to have, simply because it affects every part of your body.
A lifestyle disease that's not only costing lives, but also billions of rands.
So a shoe like this for a diabetic patient would cost something like 6,000 rands. And there's still other considerations, like these people who have had their feet amputated now go on social grants.
This is Checkpoint, and I'm Nkepile Mabuse. How many people do you know with diabetes, or have you been diagnosed yourself? According to the World Health Organization, figures have nearly doubled since 1980. More recently, it's become particularly prevalent in poorer countries. In South Africa, it's the leading cause of death after TB, and experts say treating it is costing billions. This report by Health E! News.
I was unfortunate for not playing in a professional level. I was playing a best football. I was playing very well.
Goodman Gwala has fond memories of his sporting days in Inanda on the outskirts of Durban. 11 years after being diagnosed with diabetes, the disease robbed him of his ability to play.
It was last year, 2016. When I feel that it was itching there, I went to the doctor. Doctor told me that, Goodman, your toes, your first toes there is rotten. It was paining non-stop. Doctor told me that, no, Goodman, nothing else you can do. You have to take this thing out. I was feeling scared to cut my toes. I saw myself, it will be difficult for me to walk, to go anywhere I like to go. Like now, I don't do shopping. I'm always sitting here watching TV.
Unable to work, he relies on a disability grant and the help of his elderly mother and young son.
My life is difficult now, it's not like before.
Goodman is by no means alone. The 51-year-old is one of more than 2 million South Africans with diabetes, and the number is growing at an alarming rate. At the last census, the disease emerged as the second leading cause of death in the country, after TB and ahead of HIV/AIDS. Like HIV, there is no cure for it, only lifelong treatment, which can be expensive and time-consuming. Less common type 1 diabetes occurs when the body cannot produce enough insulin needed to absorb sugar. Type 2 diabetes develops over time and accounts for the vast majority of people who have diabetes. It occurs when the body loses its ability to use insulin in the right way. Both types of diabetes cause sugar to build up in the bloodstream. These dangerous glucose levels can lead to serious health complications, including heart disease, blindness, kidney failure, and amputation. At Tygerberg Hospital in Cape Town, Dr. Magna Conradi specializes in diagnosing diabetes. She has no doubt what is to blame for the huge increase in type 2 diabetes.
The two main drivers for this rise in the numbers of diabetes patients is firstly obesity, and the other driver is actually our aging population. The reason for the obesity is directly related to us eating too much and exercising too little.
Unhealthy fast foods and sugary cool drinks in particular are major contributors to the problem, especially when consumed on a regular basis.
The main culprit is refined sugars, and in simple terms it means the sweet things that we consume on a daily basis.
Before he got sick, Goodman worked as a baker. Looking back, he realizes his habit of indulging at work probably caused his condition.
most of the time I was eating cream, donuts with sugar. So by that time, I was like this, I was fat.
And like Goodman, many type 2 diabetics only discover the ill effects of their lifestyles when it's already too late. Now he has to suffer the consequences for the rest of his life. In the months after his amputation, he's had to visit the hospital every week to have his wound dressed.
How are you, Mr. Gwala?
I'm okay, and you?
Good, Margaret.
Thank you.
Because diabetes damages blood vessels, it can restrict blood flow to the feet and hands. In severe cases, this starves the tissue of oxygen and the flesh starts to die, causing life-threatening gangrene. Amputation becomes the only option.
Everything's fine.
Goodman also sees the surgeon who amputated his toes. The doctor needs to keep checking him regularly to make sure there is sufficient blood flow into his legs. In the early stages, poor circulation can cause a loss of sensation in the feet. The resulting pain can be extreme.
Often patients will tell you, just amputate my leg, amputate my toe, amputate my foot, because the pain is so severe.
While amputation is one way of dealing with the problem, it does not guarantee an end to a diabetic struggle.
You may be fine today, but that does not mean that tomorrow you're going to be fine. Tomorrow you could start up with a new ulcer, with a new infection, with new gangrene on the leg.
His prognosis may sound dire, but Goodman is lucky. His employer supplied him with medical aid, which pays for all his checkups and treatments.
To be honest with you, without medical aid, I should be dead.
Millions of South Africans rely on the public healthcare system, which struggles to provide the levels of care diabetics need. Doctors are reporting that more than 10,000 South Africans are being diagnosed with diabetes every month, placing the public health system under increasing strain.
Diabetes is an awful disease to have, simply because it affects every part of your body, right from your brain down to your toe. It affects your eyesight, it affects your blood vessels, it affects your heart, it affects your kidneys, it affects your feet, it affects your nerves. It affects every part of your body. So you can imagine something that affects every part of your body is going to have lots and lots of complications, and lots of complications equate to numerous admissions to hospital, numerous procedures, numerous medications, numerous drugs, and the cost of that is astronomical.
Experts are seeing worrying parallels between the current diabetes crisis and the HIV epidemic at its height. Yet diabetes is receiving nowhere near the same amount of funding and resources. In fact, diabetes is often overlooked. To make matters worse, there's an interplay between diabetes and the big infectious diseases. HIV-positive people are more likely to develop diabetes, and diabetics are more likely to contract TB due to a compromised immune system. It's a problem that researchers are starting to take note of.
It's been that clinic systems, Department of Health systems, primary health systems, nursing training and so forth have been focused much more on HIV than other diseases.
The emphasis on HIV and TB means many diabetes cases are not caught in time. According to the Center for Diabetes and Endocrinology, it takes an average of 7 years before diabetics are diagnosed.
Patients will live for diabetes for 10, 15 years before they finally realize something. And the only time they will realize something is when they have a complication. And then it's often too late to reverse it.
After the break, ignore diabetes at your peril.
Either your foot or your life. So what are you going to choose? Your life or your foot?